Welcome. Today, we will further our discussion with Dr. Lawrence Elmer from the Gardner-McMaster Parkinson's Center at UTMC. We have already covered a lot of information, but today we will focus on treatment options available. If you missed the first part of our interview, get caught up by watching that episode on YouTube. Just search Toledo Cardiology Consultants. Now, here is the second part of our discussion on Parkinson's disease. So when we are talking, and I noticed that you emphasized on the hope which you can give to the patients with Parkinson's disease when you give them the diagnosis. And I assume the early detection of the disease will help to make that hope better. I mean, the success rate of the treatment, which is like what you said, you can't get the best outcome in everyone, but the earlier you make the diagnosis and the earlier you provide the treatment, it's going to be better. So if there's any marker to identify those patients who are at higher risk, like when we are talking about genetic, if there's any marker other than my family has the history of Parkinson's disease where we can check on those people to see their prognosis or their possibility of future development of Parkinson's disease?
So many people ask about the progression of this illness, and also, is there any way to predict who's going to get it? There truly are familial forms of Parkinson's, but most cases it doesn't increase your risk of developing Parkinson's dramatically. There are some very rare genetic forms, maybe less than 5% of cases, that the patients may actually have like a 50-50 chance of developing Parkinson's. That's a very rare condition. Okay. But in general, with regard to the progression, one of the things that we tell people is, and this is a very common saying, I think, among Parkinson's specialists, is that if you've seen one person with Parkinson's, you've seen one person with Parkinson's. Because everybody's different. We are so unique. The way we are made, our different sensitivity to medications, the rate that the disease progresses, the symptoms that occur, whether they're premotor symptoms or even non-motor symptoms after the classical Parkinson's disease have materialized. So there are things that we look for, but in general, we say that the course of the illness over the first 5 years of the disease is a good predictor of what the next 5 to 10 years will be. Now, one of the points that you raised is the early diagnosis. And while we're still working to identify these premotor signs and symptoms, which would allow us to literally diagnose Parkinson's before Parkinson's was actually present, that classic disease syndrome, the early treatment of Parkinson's is turning out to be even more important than we ever imagined. So, for example, in years past, again, when you and I were much younger, there was a lot of discussion about waiting to treat a patient with Parkinson's until the symptoms just became so difficult to deal with, so unbearable, that you just couldn't live without treatment. Well, as it turns out, I'm afraid we were really on the wrong path. Patients do much better, at least the vast majority of them do much better when we identify and diagnose Parkinson's at its absolute earliest stages and then treat it so that we can literally bring these people back to a completely normal state, as close to normal as possible. And we are seeing people do so much better over the long run now. Back in many years ago, even though medicines like Sinemet were available, it was not the perfect answer. In fact, one of the things that confuses people when they see somebody, a famous person like Michael J. Fox, they see him moving all around and they think, well, is that the Parkinson's? And so we have to actually teach them that's not the Parkinson's, that's actually a side effect of the medication. The classic medicine, the medicine that was literally a life-saving breakthrough in the management of Parkinson's is called levodopa. And again, while we don't want to use these big terms, we call it L-DOPA or levodopa, but it is the building block for dopamine. And the problem, of course, is that if you take a pill of dopamine, it's not able to get into the brain. But this building block, the levodopa, is. And once it gets into the brain, just like that, it gets transformed into dopamine. And it is a dramatically effective and powerful chemical. But the problem is, back in the days when it was the only medicine we had available, it was almost inevitable that people would start to develop variation in how they responded. When the medicine was at its highest point, they would develop these involuntary jerking movements that literally could throw them to the ground if they were violent enough. And that was a direct side effect of the medication. Our treatments nowadays are so advanced, so powerful, and so effective and long-lasting that, again, the vast majority of our patients never have to deal with those long-term complications. And again, I always point out, this doesn't apply to everybody because everybody's different, but doggone it, the vast majority of our patients, their symptoms are under good control, but the side effects, the complications of the disease are virtually zero. And that has to do with the fact that so many advances in the neurological management of Parkinson's.
And actually, one of the patients asked us a question, and we want to transfer that question to you, that they don't, actually she was told not to take the L-DOPA at early stage because she's concerned about that it will be less sensitive or less effective in the future.
Oh.
And if there's any truth for that.
One of the most common questions that patients ask us, especially when we go to a patient seminar or a symposium, is whether or not the medicines will keep working for some period of time. It never quits working. The medicine never quits working. The challenge is you always have to adjust or modify the medication in order to meet the needs of the brain. And this has probably been the biggest mistake in the management of Parkinson's throughout the ages, especially since levodopa was first introduced. As the disease progressed, the doctors either were not aware of the fact that they needed to advance the medication or increase it, or possibly as they increased the medicine, the side effects became intolerable. So now that we have so many tools in our toolbox, levodopa is just one of many different options that our patients have. We're able to keep them going, literally to keep this disease at bay for years, if not decades. I can think of 3 to 5 people who they quit responding to levodopa after, years and years of therapy. And so as far as I can tell, I always use my mother-in-law as the example. She had Parkinson's for 40 years. And even at the end of her life, after 40 years of Parkinson's, she still responded to levodopa. So I have the example of my mother-in-law, but I could give you thousands upon thousands of examples where the medicine keeps working. The challenge is, are you able to adjust it, modify it, or add to it correctly to keep the symptoms under control? And number 2, which is just as important, are they able to tolerate whatever treatment is necessary in order to keep the symptoms under control? That in and of itself gives people a huge sigh of relief that they know that the medicine will keep working indefinitely, and there's always hope, for them to get better, even though we are fighting a very, very challenging and progressive illness. We never give up fighting. We never give up hope. We always keep trying to keep people in the best possible quality of life that they can experience.
And it's amazing that most of the Parkinson's disease patients are fighters. I mean,
Yes,
they want to get better.
are.
They don't want to continue with that
I
disease.
love
and
that.
I think that's really an amazing thing. That brings us really to the advancement in research, in technology, and what's the future? telling us about Parkinson. I hear about a lot of things coming. If there's any way we shed the light on some of these items.
So if you want to talk about research, we could be here for a very long period of time, because there are many, many new advances that are in development. In fact, some of the medicines that are being used for the treatment of Parkinson's, I mentioned this medicine for hallucinations. It works on a completely different area of the brain. There is a medicine that mimics the effects of caffeine. Typical caffeine in our coffee and our Coca-Cola products and stuff like that. This medicine that works at the same place where caffeine works also helps to treat the symptoms of Parkinson's. Probably our biggest breakthrough wasn't even in the pharmacologic range, but was in the realm of deep brain stimulation surgery. We realized years ago that due to the lack of dopamine, the electrical activity in the brain was actually changed. It was distorted. And we think that that distortion of electrical activity contributes to the symptoms of Parkinson's, the classic stiffness, slowness, and shakiness. Well, by putting a very tiny little wire in a very small part of the brain, about the size of a black-eyed pea, if we put this electrode in there and connect it up to a pacemaker-like device, this is called deep brain stimulation surgery. And we are actually starting that at the University of Toledo Medical Center. Our neurosurgeons and my colleague, Dr. Menezes, have been working together very, very closely. Dr. Godin, Dr. Schroeder, Dr. Medcore, all neurosurgeons, and then our Dr. Menezes, he is a specialist in electrophysiology of the brain. So they take people into the operating room, they numb them up, and they actually put them to sleep very briefly so that they can drill through the skull, but then they use a very special needle that allows them to monitor the electrical activity as they search for a target that has been already pre-identified using very, very fancy MRI and computer techniques. And they look and they look and they look until they find exactly the right spot. And they mark on their computers exactly where that is, and then they take out that recording needle and they put in the stimulating electrode. They connect that up to that device. We typically wait about a month before we turn everything on so that the brain can kind of settle down from all that, that excitement of having surgery done. Thankfully, it's a very safe and well-tolerated surgery. But then when we turn that on, the electricity resets that distorted electrical activity. A gentleman who was unable to stand, his tremors were so bad, affecting both sides of his body, he couldn't get up on his own, so the nurse had to help him get up. And then when he walked, he could just barely make these little baby steps. Well, then we went from having the devices turned off to having the devices turned on. And you wouldn't believe it. You'd think you were looking at a completely different person. There he sat, no tremors at all, big smile on his face. And when asked to stand up, he just stood right up on his own and started walking with no problems at all. And that, believe it or not, Dr. Kabour, was without any medication at all. He was only getting the electrical stimulation. And this is the only thing I want to mention about DBS, because some people think, oh, it's a cure, or I'll never need to take medicine again after I do that. Well, as it turns out, people do still need to take medicine, but they take much less. And because the electricity is there 24/7, they literally have control of their symptoms every day of the week, every hour of the day.
Does that suggest that every patient with Parkinson could be a candidate for that?
Well, every person with Parkinson's certainly could be considered as a candidate for Parkinson's, but most of our patients, thankfully, never have to consider going for that kind of surgery. Why? Because we have so many new medicines, and the medicines are so effective. many cases, the medicines are once a
But
day.
technically, it's available right now
It
at
is
the University of
available, and
Toledo
it's
for the people who are very advanced, who failed
exactly
the medications.
exactly for the right person in the right situation, where either the medicines are no longer working optimally, or maybe they just can't tolerate them because of side effects. And we recognize everybody's different. Not everyone can tolerate the right amount of medicine or the right combination of medicines. The DBS is a tremendous breakthrough for them.
There's two things which we need to address before we finish this episode. The first one is the exercise. Now, you promised that to give us some instruction about types of exercise which his Parkinson patient should do.
Yes.
Or if there's any way you give us in summary, and then probably we can show it later in the episode with some patients.
Great. The first major breakthrough was a therapy called big therapy. And they use the term big just because of the exaggerated movements that they do during this therapeutic routine. There was a young woman who was doing her doctoral dissertation in physical therapy. This was out in Arizona. And she knew of a treatment for speech problems in Parkinson's called the Lee-Silverman voice therapy, where patients would actually yell and scream and talk at the top of their voice. And what happened was, in that process, their voices became more and more normal. Normally, a person with Parkinson's, if untreated, their voice gets very soft, very hard to hear. And as a result, the voice therapy was a breakthrough for many, many patients. Well, this researcher, doctoral candidate, she actually adapted those techniques to her physical therapy and applied them in a way that now these people are, it's almost like they're shouting with their muscles. They're yelling at the top of their lungs with their legs and their stretching movements. And they continue to do these therapies for a total of 4 weeks. And then they have assignments to do at home. These movements, these Parkinson-specific therapies have literally changed the course of the disease for thousands upon thousands of people all around the world. In addition, we've learned that if you take a person with Parkinson's and you put them on a tandem bike with a professional bicyclist, and that professional bicyclist is pedaling at their normal rate, and the Parkinson's patient is trying to keep up, huffing and puffing, just pumping those, those pedals as fast as they can. When they get off the bicycle, they can walk normally. Sometimes their tremor is gone. Sometimes their handwriting is better. Wow. And so now they've come up with something called the TheraCycle, which is a type of an electrical stationary bike which can be used for Parkinson's patients. They literally strap themselves on, turn it on, and hold on for dear life because it pedals as fast as they can possibly go. And by doing that repeatedly, that also helps to treat the symptoms of Parkinson's. And the third one that I would mention, the one that has gotten a lot of notoriety, at least in this area, is boxing. It started out as a group called Rock Steady Boxing. Our group here in town, I think they adopted a different name. But the actual process of, boxing a bag or boxing, someone else, in protective gear, all the footwork and everything, this has been shown to have dramatic positive benefits in the world of Parkinson's disease. And then the last one I have to mention because they're such close friends, we've worked so closely together. There's a group out of Columbus, David Zid and Jackie Russell started something called Delay the Disease. Now you'll find this interesting because as physicians, we're never supposed to get sick. But as it turned out, there was an orthopedic surgeon who developed Parkinson's, and he hired David as his own personal trainer. Well, David recognized over a period of time that there were certain exercises that actually gave this orthopedic surgeon much more benefit than other exercises. So he partnered up. Jackie actually was the orthopedic surgeon's nurse, so they partnered up and they came up with a very, very elaborate but simple to use, just things you can do around the house. All of these represent non-pharmacological, non-surgical ways to actually retrain the brain. And I think between you and me, that's probably been the most amazing discovery that we've made, is that in addition to these patients being real fighters, they are never willing to surrender to this disease. The brain, even as we get older, it contains the capacity to adapt, make new connections, and actually improve a patient's condition without having to rely solely on medications or, you know, surgical options or something like that. The brain rises to the occasion. We call it plasticity. It literally adapts and molds itself and makes the connections necessary to bypass the damaged areas, giving these people their lives back.
When we are talking about Parkinson and the environmental triggers, as you reported it, what about nutrition? I mean, if there's any relationship between the type of nutrition Parkinson patient should follow?
Yep. There have been many, many discussions about nutrition and vitamins and, you know, different types of holistic therapies.
Yes.
In fact, you'd be interested in this because from a cardiac standpoint, coenzyme Q10 is one of our go-to medications, both for the heart but also for the brain. And we thought that CoQ10 may actually slow the disease progression. There was a huge study, however, and while it was considered safe, it did not seem to slow the progression. But I'd like to come back to something we discussed earlier, identifying people in the premotor state where literally no damage has occurred to the dopamine nerve cells. There is a possibility that CoQ10 could work in that premotor state. And now we just have to wait and see once the testing is done. From the other standpoint of just the foods that we eat and the liquids that we drink, there are certain things that we always try to emphasize. Number one is being healthy as you possibly can be, whether that means eating healthy foods, exercising regularly, sleeping regularly, avoiding bad habits like smoking or drinking alcohol excessively. All of these are good rules to successfully manage Parkinson's, as they are any disease process. But there are certain foods, and I think eating a healthy diet like lots of fruits and vegetables, that's very, very important. But one aspect of nutrition which is not usually discussed has to do with the fact that levodopa, I mentioned earlier, levodopa is the building block for dopamine. It has the same structure as a neutral amino acid. Sure. Well, we know that amino acids are really the building blocks for protein, and protein is a major component of most of the foods that we eat. Protein it's what we use to build muscle. It's a very important part of our diet. But if you take levodopa at the same time that you take food with protein in it, it can actually inactivate the levodopa. The protein will block the access of the levodopa into the bloodstream and of course then eventually into the brain. And by separating the levodopa, taking it an hour before the meals on an empty stomach with something like water or juice. Now, one of the side effects of levodopa can be stomach upset. But most people, after they've taken it for a while, can easily take it on an empty stomach. But good nutrition, good diet, sleep, maintaining good bowel hygiene, keep the bowels moving safely and on a regular basis so that people do not, you know, back up with stool and have other complications.
That's great. That's great. It's always wonderful to hear everything you want to learn about a specific disease or illness from the expert, and really we learned a lot. I learned myself really a lot about Parkinson's disease today. We really appreciate your help. If the patients, and I have no doubt that too many patients right now wants to reach out to your center here, how can they get to this center, this wonderful place, which is we are happy to have it in town, because I know that there's too many people who can get the help.
We're always wanting to help as many people as we can with Parkinson's, and that's why the Gardner McMaster Parkinson's Center was built. A dedicated center for the treatment, the diagnosis, management, and further treatment of Parkinson's disease for hundreds, and actually we're up to thousands now, of people that we treat. What surprises me so much, Dr. Kabour, is that despite the fact that we see hundreds and hundreds of new patients every single year, there's always hundreds and hundreds more waiting to get into our clinic. And it always breaks my heart when I hear the story of someone who's been struggling with the symptoms of Parkinson's, and they've literally had to wait 4, 6, 8, 10 months to get into our clinic. One of the things that I'd like to emphasize to your audience, if they are really struggling with their Parkinson's, either they or their family doctor can call, and we will move heaven and earth to try and get them in as soon as possible. We're working our hardest to try and treat as many people as possible. We also have an annual symposium that we hold. April is considered Parkinson's Awareness Month. So every April we meet here in Toledo, and if they go to our Facebook page, the Gardner McMaster Parkinson's Center, or if they go to the Parkinson's Foundation of Northwest Ohio, they can find out information about the symposium. And we always have new and exciting topics. We always talk about the latest and greatest in research. We always talk about the latest and greatest treatment options. But in a sense, that's our opportunity to speak to hundreds upon hundreds of people with Parkinson's and their families and give them hope for another year that, doggone it, I'm going to beat this disease. I'm not going to let it beat me, and we're just going to keep on going, and we can look forward to a great future together.
Pleasure meeting you, and pleasure listening to you and learning from you, and really I have no doubt the audience is going to enjoy this episode significantly, and, we're really so glad and happy to have your expertise in town.
We are so grateful that you came and are willing to share this with your audience, and I, at any time, I would be more than willing to share. We have so many updates, and like I said, if I had really gotten started, I'm afraid we would have been going into the wee hours of the night.
Really
There's so much to talk about with Parkinson's.
Thank
you, Dr. Kabour. Thank you.
Yeah. I hope you have enjoyed this two-part episode. If you or someone you know could be suffering from the symptoms of Parkinson's disease, get to a specialist immediately, because remember, time waits for no one.